take the lead here since we have this little guy with us, and he'll fill in where he needs to. Yeah. Are we good to go?
Mm-hmm.
Okay. So yeah, we were actually in Bradley class. It was a year ago this month. So we did the winter class. And I knew that we wanted to pursue a natural labor and birth as much as possible. So we were really happy with all the techniques we learned. Anyways, fast forward to the day before I went into labor. My parents, I always think this is a funny part because Christine always says you need to eat, make sure you eat well and then sleep well. And it just so happened that my parents made a turkey Thanksgiving dinner the night before I went into labor because my sister wasn't able to make it for Thanksgiving. So I ate so much, gosh, like a whole second Thanksgiving meal. I was stuffed, and while I was at their house, I just started having more Braxton Hicks contractions, and kind of nudged him, and I was like, I think it's time to head home and maybe get some rest tonight. So sure enough, we get home, and about 9 o'clock, I thought, all right, these are a little stronger and a little more consistent. Much more of that, just like a wave of heat or pain or discomfort that you could feel. And it felt more consistent. So I told Jeff to start timing. He had the fancy iPad contraction, or you're tracking your contractions on the iPhone, and so he's like, yeah, it looks like you're pretty consistent. So the next thing I thought is, okay, I ate really well, now I'm going to try and get some sleep. So I tried to lie down, and lying flat was just not the position for me, so I was standing a lot. And then we decided to try the shower, and that ended up being just like my saving grace. Standing in the shower, I still, when I get in the shower in our house now, I remember like so vividly that day of just standing in there for probably hours, and Jeff sleeping at my feet outside of the shower with our golden retriever, sleeping there at night. So we did that for hours throughout the night. I did end up getting some sleep. I remember waking up in the morning, being asleep next to my bed. Not really sure how that happened or why I ended up being more comfortable next to my bed, but it was just a matter of taking each contraction as it came and deciding in that moment, all right, I think the shower is the best for me. I think lying down is the best. I think lying on the floor next to my bed was the best. Having contractions over the bed. And I just kept reminding him that he needed to get sleep because we had no idea how long this was going to last. So the next morning, I actually had I had an appointment with my midwife, and that had already been scheduled. So we went in, and I told her, we've been laboring throughout the night. She's like, I'll check you, but I don't know, what. And so she seemed a little bit skeptical. She checked me. She's like, oh, girl, you're in labor. You're 3 or 4, fully effaced, bag of water, bulging. You could go, anytime. So she monitored me, let me kind of relax in the big chair, and they monitored me in the office. Everything looked great. She's like, I'm just going to send you back home, and it's going to be up to you when you come back to the hospital, and we'll see you today. So it got a lot more real, of course, with that, knowing like, all right, we did this at home, and we're just going to keep going with it. So we go back home, a lot more time in the shower, a lot more time standing up. And the next thing I remember was I was in the shower, and I started crying, and telling Jeff that I didn't think I could do it. And that was his cue to get everything ready to go to the hospital. So I kept repeating to him that no, I don't want to go too soon. I don't want him to think that I couldn't do this. And what if we go too early? And that whole thing. He's like, all you need to do is just get in the car. You don't have to do anything else except for just get your body and sit in the car. So
there's a lot of progressive bargaining. Like we got the laundry, and like that was a victory.
Yep.
We got in the car, but I was going to start the car. I'm going to crawl around.
So yes, he got me in the car, which was great, job coach. And we drove to the hospital and get into triage. I remember having a very vivid contraction right outside of the hospital, like on a stone pillar thing that I was leaning over, and feeling like everybody was watching what this crazy lady doing. So they get me in, they get me up to triage. We tell the triage nurse that, you know, we've been in labor since the previous evening. She, again, felt kind of skeptical, like, oh, okay, we'll check you, we'll see where you're at. She checks me, she's like, oh, okay, you're a 9. Or she said, what did she say? How do you feel about a 9?
Yeah.
And we were like, we feel great, you know, it's like that wave of just like, oh my gosh, I cannot believe we did this, like, we're here, we're ready, you're excited. So Jeff progresses to, obviously, like, call all the family, you know, she's on a 9, get to the hospital. She's like, it could be at any point, but there was something about my bag water that it was just, she thought once my water broke that it would just go really quickly from there. So I was a 9, fully effaced, meaning cervix is totally thinned out, but she couldn't tell the station of his head, just because that bulging bag of waters was still there. So they didn't really know how low he was. So she's like, here we go. She's like, I don't even have time to prep I don't think we have time to prep the tub, which is something that I thought maybe would be nice. And instead, she's like, I'll just get the shower running and we'll go from here and we'll have this baby before my shift is over at 7. I remember her saying that. And this was about 3 o'clock in the afternoon, just to give you a frame of reference. So we get in there. I don't know if anybody here, my midwife was Valley Women for Women. I don't know if anybody else has.
Yeah, actually, the mom on Skype is Valley Women for Women.
Oh, okay, mom on Skype. So we get there and she's like, all right, just continue to do it, keep doing what you're doing in the shower. I mean, at that point, the contractions were totally and completely intense. I mean, it was everything mentally, physically that I had prepared for and expected, but it felt productive. It felt like, all right, this is going to get us to the end where we need to be. It didn't just feel like too overwhelming, I guess, at that point. It was just like, all right, I know this is how it's supposed to feel. This is supposed to be intense. This is supposed to be painful. This is supposed to be how it is. But the one thing that they kept telling me was that, all right, you're at a 9, you should be feeling pressure. You know, when you feel pressure, you're going to feel the urge to push. You're going to feel the urge to push, and I just never did. 3, I was in and out of the shower. Got back to she actually checked me while I was in the shower and actually monitored. I was not on a monitor, I was not IV anything, I was just kind of waiting for it to happen. And so she kept checking me with the Doppler in the shower. They finally got me in the bed to check me and she's like, well, you're still at a 9, but that bag of water is still right there. So the plan was to do anything I could to try and get that bag of water to break on its own, rather than to have them break it. So I tried, and this is where it got a lot more intense and a lot more painful, was they had me try different things like to do that asymmetric squat like over a ball, or I tried that for multiple contractions as much as I could handle. I tried actually squatting into contractions. So a lot of different positions just to see if we could like get that bag water to go, and then like, you know, let's get this show on the road. So we tried that for a couple more hours, and about 7 o'clock at night, still nothing had happened. So we've been there about 4 hours, and I was still at a 9, still fully effaced, still have that water hanging on. And no one seemed concerned at that point. We were just kind of like, you know, doing what we were doing. And the I guess suggestion came up for them to break my bag of water to, you know, if it's right there, then maybe this would really be the thing to progress this along a little more quickly.
That's not totally how it went.
Okay,
Yeah.
fill me in. I told him, I'm like,
Sorry, I'm
No, you can, no, go ahead.
so you're gonna have to.
Yeah. No, at that point we had gone through the conversation about it. Like the bag was bulging, and so because we were talking to the midwife, and I guess like,
Yeah, you gotta get Bennett.
awesome dad.
Raised in Arizona.
Yeah. It was one of those deals where we had been talking, and Janice was really good, the midwife that we were working with. And I think that's honestly like what I picked up from doing class and everything, was just about communicating with like your like birth team or whoever you're working with. And like in talking to her, we had kind of gone back and forth and said, hey Janice, how do you feel about this? And she's like, you guys go as long as you want. Like, heart rate's good and we're feeling good about this. Like, you keep going as long as you want. And we had gone for a little while, and at a certain point I said, well, look, you've done like, 1,000 births, and this is my first, so like, if it were you, what would you do here? She's like, at this point it's been a little while, and like, I think it might help to just break the bag, and we can go ahead and move things along. And like, we're confident that the head will go down into the birth canal at that point, and you guys will have a baby, and we'll be out of here. So like, I talked to,
Yeah, I mean, I do remember having those, that dialogue with her,
Yeah.
which is great, because she wasn't like, we need to do this now, or else, we're gonna kick you out of the hospital, or anything like that. It was a conversation, which was huge to have a care provider that allowed you to have that type of conversation. And again, a lot of this was blurry because I still was, in a little bit of pain. So we decided that we were gonna go forward and having her break my water. And she broke my water, and her face kind of fell flat. I saw, and she said, all right, remember when we talked about breaking your water? And she explained it, I remember this. She's like, and we want it to be really nice and clear. Yours is green, and it's dark green, and that means that it's meconium stain. So that means that the baby has that first bowel movement in utero. And they called it thick meconium, so it wasn't just like a little bit, but it can be, after I did some more research, of course, after you're born, I'm like looking everything up, but having that thick meconium can be an indicator for a baby being in some sort of distress. So what they do for that hospital, you're required to be hooked up and stay in bed, and kind of just precautionary to make sure everything's okay. So they hooked me up, they gave me an IV, I had a fetal monitor on and everything like that. And I couldn't stand anymore. So all of my contractions up to this point had either been standing in the shower, standing up holding Jeff, standing up over a chair or something, and at this point I had to lie flat on my back. And it went from feeling like a very productive type of pain, and at this point I still am not feeling that urge to push. It felt like it was a different type of pain. I took a turn to something that didn't feel productive anymore. It didn't feel like I thought it was supposed to feel, or it had been feeling. And at this point is when it gets quite blurry, because I remember gripping the sides of the bed and that sort of thing, and just being like, kind of trying to explain to myself, maybe I have to get past this point in order to get there. And sure enough, we get to about, maybe 9:30, 10 o'clock.
Thereabouts, yeah.
Yeah, it was much later in the evening, so I did have those really pretty excruciating contractions for a couple hours in the bed. It doesn't feel like that. I don't remember that at all. And at one point, Janice comes in and said, hey, I think if we want to do this vaginally, which is our ultimate goal, that we are going to have to talk about some sort of intervention to get you there for the rest of the way. And she had this conversation with Jeff mostly because I wasn't really able to.
Well, that was actually a conversation we had out in the hall,
Yes,
originally.
okay.
So like, Jess was doing her deal, and I think it was one of those things like where, I don't know, I can't underestimate like how much like all the videos and everything kind of like did help. And at first, like I'm watching them, I'm like, oh, gross. Like, but going through the whole process of watching that, like you kind of see what productive pain looks like and what it doesn't look like. And at that point, like, because we had her over the ball laboring, and like you got into a position like where you were trying to really like bear down. And at that point, I remember like it was a different like, I don't know, a different kind of pain, like reading on your face, it wasn't kind of the same deal. And so like at that point, I went out and talked to Janice and said, I don't know, how good I feel about this, like from what I'm seeing, and I don't think she really knows where she is right now. I'm like, how do you feel about that? And she's like, well, that's a decision that you guys have to make right now. And, either way, we'll let you keep going. All the signs are okay for us, like heart rate's still okay, so we'll let you keep going if you want to, but if it doesn't feel productive, then maybe we need to talk about that. In addition, you guys have been going for a long time. Jess is a pretty small girl, so we don't really feel like, we don't know how much she's got in her, and like you'd be a better judge of that than us. And like, so at that point, talked a little bit more about it, and then came in and said, all right, talk with Jess, which was a weird conversation. Yeah, and talk with.
Much we were able to talk. I mean, we did decide on epidural, and I'll give you the time frame just because it kind of this sequence happened really quickly. So I did consent to an epidural, and the anesthesiologist came in, I think, at about 10:30. Yeah, about 10:30 he came in. I remember holding my midwife, and she's like, he kept saying, the anesthesiologist, he kept saying, this might hurt a little bit, this might sting a little bit, and I wanted to be like, are you kidding me? Like, I'm just getting 26 hours natural labor. Like, you have no idea, like, I didn't even feel it. And so if you don't be scared of the epidural, I mean, in my position, it was like an IV, very minimal pain. And so yes, he gave me the epidural and he said, you know, how are you feeling? Do you have a metallic taste in your mouth or anything like that? And I said, no, nothing like that. He said, you'll feel your toes start to tingle. And sure enough, I felt my toes start to tingle, and I was like, yeah, I wasn't this happy and cheery saying this, but I probably said yes. And my midwife just kept reminding me, you know, you're only gonna feel a couple more of these, and then we're gonna get you some relief here. And just as he left the room, I heard the heart rate on the monitor just totally drop.
It dropped off it's like it dropped off the table, like it was going like that. You know, like when you guys go to like the appointment, it's like whoa, 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 whoa.
It was just so
and,
slow.
From there,
I
like
remember
the pacing got really
saying his
weird.
heart rate. And the nurse ran out of the room and ran back in with two other nurses, and they're like, we need you flipped on your side now. And they flipped me on my side, and they were like, we need you flipped on your other side now. They flipped me on my other side. My sister was in the room, and she was my trusted other person in the room. She's a nurse. She's like, I was so shocked to see you move that quickly because I hadn't seen you move for hours. You know, you've just been like sedentary. So, and she's like, I need you flipped on your hands and knees now. They flipped me on my hands and knees. By the time I was flipped back to my back, a doctor came running in with Janice. There was probably 3 other nurses in the room, and she's like, I'm Dr. So-and-so, I'm going to check you. And she checked me very aggressively. And with that, in the same breath, she said, and Janice said, this is not an option, we're going to wheel you in for a C-section now. The method class taught you, it's like, all right, well, you know, if you do have a C-section, you know, you want you want the coach to stay with the baby, and then you want, you know, maybe someone else in the operating room with you. And so Jeff asked Janice, she's like, oh, okay, you know, is Hannah coming with us, my sister? She said, no, it's just you. So the gown came up really quickly. I don't remember any of this. I'm just kind of saying like what was said back to me.
You're about right, yeah.
And they wheeled me down the hallway very quickly. And the whole time I get very emotional and start saying, am I going to feel it? Am I going to feel it? Because the only thought in my head was, I just got this epidural and I can still feel everything. So I was sure that I was going to feel the surgery. And so they wheel me into the room, strap me down, and the doctor puts a blunt object over my stomach and says, can you feel this? And I say, yes. And they knock me completely out. Which, looking back, was probably a big blessing, because I didn't have to, I wasn't conscious for the birth of my child. That, you know, will be something that I will always remember, or not remember, and that's hard to think about. But at the same time, I kind of got to be done with it all at that point, and Jeff took over, and just be prayerful about, right, this is, you know, going the right direction, and we're going to end up being okay here. So I was knocked completely out, and when I came to, I remember seeing my midwife and my doctor there, and they said, he's beautiful, you know, everything's great, he's perfect. We got pictures. Since I had so many drugs and they knocked me out, and I hadn't had so much as an aspirin my whole pregnancy, so I think it hit me pretty hard, and so a lot of it's pretty blurry. But he was perfect and beautiful, and he did not aspirate, so that was the main concern. They had a big team there ready, just in case he had aspirated on that meconium fluid. He didn't. He came out with a cry right away, so that was really good. He was heavily jaundiced, but other than that, we were good to go.
Can you share with them why? Can you share with them why you guys found out?
So about a week and a half after he was born, I just knew something was off, right? I just knew, looking at him. So he came out with a very prominent kind of bruise on his forehead. And that's kind of what the midwives explained, like he was brow presenting, he presented brow first. And I was like, I just don't get this. Why did he not, come down for, almost 7 hours, being in a 9, like, why did he not descend down? They just thought that he had his chin up instead of tucked, right? And that his prominent brow got stuck and was literally rocking in my pelvis rather than descending down. So I started Googling infant head shape. I felt like something was off. I just don't think his head is right. I had a best friend who delivered 3 weeks later. I was like, his head does not look like my baby's head. Like, I feel like something's off. And at his 2-month appointment, I mentioned to the pediatrician, I'm like, I just don't feel right about his head shape. And I'm like, I feel this ridge on the back of his head. It was like a bump. But I'm like, baby's heads feel bumpy and weird and soft and squishy and strange, so I didn't know. I mean, it's like, I'm not liking it too much either. He's like, I'm going to send you in for an x-ray, and he started to explain some of these things. So really quickly, within the next week or so, we found out that he was going to need a pretty intense surgery to remove a piece of his skull, and it had to be done at about 3 months old. So really briefly, it's called craniosynostosis, and it's when the plates in the baby's skull, they actually fuse prematurely in utero. So looking back, now we know, and we kind of asked our neurosurgeon and midwife and just got some other opinions of chiropractor. They all said that it's 99.9% sure the reason why he was not dropping down is because his plates were already fused, so they couldn't do that great overlapping and then drop down the birth canal. So he literally was stuck, totally stuck there. So we got through the surgery, which was way more traumatic than birth, and he wore a little corrective helmet for a couple months, and he was great. He was doing awesome. So we were just so blessed and couldn't be happier. And we will answer any questions after that.
So what do you guys feel you took, that you used from the classes? Like for you, what was your, as you guys were going through this process, what stuck out to you?
You know what, I think for Jeff, Jeff was saying that on his end, that communication part, I think was really big. Being able to communicate in the moment, in a very intense situation with your care provider and feeling comfortable with that care provider. For me, I felt really maybe emotionally and spiritually prepared for the pain level and knowing right, this is supposed to feel like a birth, this is no joke, this is, so I felt very comfortable with that, and that day it's a very kind of looking back at a really special day. I remember, you're in yourself a lot, and very thoughtful, and so anyways, I think I was able to use some of the relaxation techniques, and watching lots of video of other women do this naturally was helpful for me, to see that, okay, they get through this and it can be done. It just takes a lot of, inward thought. And we came away some really awesome friends too, so that's been cool. We've stayed in contact with a couple other families, and just overall, super awesome. We said it was the best thing we could have done for him, the best thing we could have done. And even looking back, we used some of the same communication techniques and even relaxation techniques in the hospital with him when he had his surgery. Talking to the doctors, what are our options, making sure we're very clear about our options and choices for him, because that took on a whole new level of importance when we were in there with him. So.
Awesome. Are you guys any questions from?
Yeah. How long did it take you to recover from your C-section?
That's a really good question. I'd say a solid 3-4 weeks. I can't remember exactly how long I was on the med, but that was one thing that I actually, the day after he was born in the hospital, I hadn't been as on top of asking for my med as I should have been, thinking yesterday I was in so much pain, and today I'm in pain, but it's nowhere near what I was yesterday. And I kind of forgot about keeping on top of them for my med, and I ended up standing up and almost passing out. And the nurse looked at me and she's like, you need to be, your pain medication, you need to be on it. You need to not be refusing this. You need to make sure you stay on it and not be scared to stay on it. Because I was almost like scared, like, oh, I don't know, I'm nursing him, and what if, there's something? It's like, no, you need to stay on it for as long as you can to recover fully for him.
So it's totally safe to nurse with the medications they give you?
And you're not. I mean, I think I was on morphine for obviously just the time that I was in the hospital, and then after that, they give you things that it's gonna be okay. And it's in the long run, it's like you need to recover and make sure you're doing okay in order to move it along. So yeah, I'd say like a good solid 3-4 weeks until I didn't feel pain like sitting up in bed and getting in and out of bed and in and out of the couch and stuff like that. So.
I got questions.
Yeah.
Do you know how come your baby's heart rate slowed down?
That's a really good question too. We don't know if it was connected to the epidural. We don't know if it was totally random.
Which is right after the epidural?
It was right after the epidural, and you do hear that sometimes. And he had some D cells, so it's not like his heart rate had been super, super perfect, and all of a sudden I got the epidural and it dropped. Like he had some pretty nice D cells, but things we were able to kind of position me out of. And so it could have been that the epidural meds just gave him that little like, all right, we're done. Like I can't handle this or whatever it might have been. But it was really, really quickly after I got it. But again, I hadn't even felt it. I mean, it hadn't progressed throughout my body, so I don't know, how quickly it really crossed that, like, we call it like the blood-brain barrier or whatever, to him. So it's kind of a mystery.
How was he okay with nursing after all of that?
You know what? Yes. The hardest part was that he was jaundiced, so they had to keep him under the bilirubin lights for a full 24 hours, which means that he was not in the room with me. And honestly, I remember that being a day that was really, really hard. Just feeling frustrated. Like, I want to try to nurse him, but I'm only with him for 30 minutes every 3 hours. So we eventually realized that he was having a little bit of trouble nursing. I was in a lot of pain with it, and we immediately called a lactation consultant. She came. He was born on a Monday. We got home on a Thursday, and she was there on Saturday. So it was Debbie Gillespie who works right there, and she was phenomenal. She told us that he had a tongue tie, and so we kind of had to decide what to do with that. So he did have a procedure to actually snip his frenulum, which at the time seemed like oh my gosh, a big decision to make. And looking back after his head and skull and everything, we were like, it was easy. We got it done and it helped, and we were like on the road. So anyways, if you run into difficulty, I think the main thing would be like just call as quickly as you have your husband call. She said rent a hospital pond. We were like here. So we just kind of moved quickly. And now he's still nursing, so we're doing pretty good.
Any dads have questions for Jeff, coach, as far as coaching?
Is it hard to keep your cool going? Because as things progress so fast, was it hard to kind of just keep your brain clear and make the proper decisions?
It's I don't know. Yeah, but like at the same time, like you kind of just, what's the matter? You kind of just do, like, because at the point when his heart rate dropped, like, as much as like I wanted to be like the guy like in charge on the whole deal, like they threw scrubs at me and they said, all right, you're gonna meet us out in the hall in 5 minutes, and we're taking your wife right now. And I'm like, okay, like, I guess like that's the, but I think like going through the whole process, I think the benefit was like just like through this class, like Jess and I had talked a little bit about just kind of like plan B a little bit, and I think that really helped. It was like, like, all right, well, what happens like if this happens? And like we weren't trying to plan it down to like, what happens if we get a flat tire or like it's rainy or, but like it was just like, if there's a C-section, like what are we going to do, and who's going to stay with who, and like the whole like are you going to go with the baby? Are you going to stay with me? And I think that helped just because like, yeah, and like in the back of my head, at least I had like the playbook, and I was like, all right, well, I know what route to run, like, and I'm all good from there, and like that was it. So, I mean, yeah, so it was hard, but like at the same time, like you just kind of.
So you guys communicated that well beforehand?
Yeah, like, and it was weird because I remember us like talking about it in class, and it was like, you know, you want to kind of come up with a game plan, and it was more like. We didn't sit down and be like, all right, let's, you know, like, let's write it all down. But it was just like, all right, well, so, like, what happens if that happens? Like, what do you want to do? You know, how do you feel about that? And real, like, honestly, I don't want to make it sound like we sat down and, like, had this full, like, hashed out, like, plan B. But, like, talked a little bit, like, you know, enough to kind of know where we wanted to be, like, just in case.
Just in case part, which is, we had talked about. So.
Yeah.